New tonight, more than 5 million Georgians are now fully vaccinated against COVID-19. That's good news, and it's according to brand new data from the Department of Health. Well, now Pfizer wants the okay to use this vaccine for kids 5 to 11.
And a lot of folks have been sounding off on our Facebook page. We're seeing your comments of some misinformation and confusion. So you know how we do this. Letitia Lance joins us live with some of those verifying facts.
Yeah, there can never be too much information when it comes to our kids, right? So if the emergency authorization is approved, that would mean around 25 million more American kids could get the vaccine. There were a lot of concerns from you on our Facebook page, as Ron just said, about teens dying from getting the vaccine. So you asked, now let's verify.
Are teenagers dying from adverse reactions to the COVID-19 vaccine? Our sources are the CDC, the New England Journal of Medicine, and the Georgia Department of Health. The CDC's Vaccine Adverse Event Reporting System received 1,226 reports of myocarditis, or inflammation of the heart muscle, after receiving an mRNA vaccine between December 2020 and June 2021. A CDC safety panel found a likely association between rare heart inflammation in adolescents and young adults after their second dose of an mRNA COVID-19 vaccine, finding 323 cases fit criteria for myocarditis. The average age was 19. 96 of those patients were hospitalized, and at the time of review, 95% had been released with no deaths. A recent study published by the New England Journal of Medicine showed the risk of heart problems in boys 16 to 19 was about 9 times higher than unvaccinated boys the same age. The Israel study looked at data from 2.5 million vaccinated people 16 and above and identified 54 cases of myocarditis. 70% of the cases showed up after the second vaccine dose. The majority of the cases were mild. One patient with a history of heart disease died of an unknown cause after release from the hospital. The Georgia Department of Health reports 0 deaths of people 12 to 17 after receiving the vaccine and 1 for those 18 to 34. So we can verify that while some teenagers developed heart problems from receiving the COVID-19 vaccine, there's not enough evidence to say teens are dying because they received the vaccine.
And we should also point out Pfizer's vaccine dose for children it's not the same as adults, the one that adults get. The kid-sized doses would come in vials specially marked for use for children, and that is to make sure there are not any mix-up medicine.